everyone, and welcome to another episode live streamed of Coffee Talk in the Athletic Training Room. Great to be with everybody again. This episode will be aired on recording anywhere you get your podcasts and on YouTube Thursday, tomorrow, the 25th of April. As usual, every Thursday we try to get a new episode out to you guys. But we thank you for listening. This episode, as with all our episodes, is brought to you by the official sponsors of the Athletic Training Room, Essity and Firefly Recovery. You can find, if you're listening on a podcast or on YouTube, we'll put those links in the description so you can learn more about those companies. But make sure you give them a visit. Big thank you to Firefly and Essity for supporting athletic trainers everywhere, supporting the Athletic Training Room. We are streaming live on Instagram at Athlete Advise. We are also streaming live on Facebook right now. My Facebook page, Brian. I'm glad you can find that if you follow me. And yeah, ask any questions that you have. We'd love to talk to you and hear from you live since we are streaming. Won't be that long of an episode today. We don't have a guest, but I do want to kind of touch on a few things and some things I've been thinking about this week and watching some of the baseball and events going on and things like that. I know we've been talking a lot of upper extremity lately, particularly a couple weeks ago when we discussed some maybe not misunderstood, but lesser thought about factors and to go into preventative and prevention and rehabilitation of upper extremity injuries. And so today I wanted to kind of shift gears a little bit and go kind of back to the lower extremity. We talked about the lower extremity a little bit with as far as recovery goes in our first episode with Anthony from Firefly Recovery, Anthony Jenstead from Firefly Recovery. Make sure you give them a peek, but at recoveryfirefly.com. But we talked about the recovery aspect of it and putting the device directly on the perineal nerve to stimulate that and increase blood flow. And kind of over the last couple of days, watching a lot of uh, basketball, obviously the NBA playoffs going on, and baseball season is obviously getting into full swing here, entering the almost the entire first month gone, and really started thinking about knees and knee injuries, particularly with Jimmy Butler's injury. Although his was, I believe, an MCL. I don't think it was um, really what we're going to talk about today, but also lower extremity injuries to Joel Embiid over the last couple of days and his recovery from that, and um, watching the White Sox um, Twins game yesterday, torturing myself and watching that disaster of a poor excuse for a sporting event. Neither here nor there. However, um, and Byron Buxton and his issues and with his knees and his legs and his injury history, and it's great to see him come back. Obviously, hit the game tying home run in the ninth inning yesterday, along with a double. So obviously making some comebacks and recoveries. It's always great to see. And then what really got me thinking about this topic was watching the same game the White Sox just brought up again, Danny Mendick. And many of you may remember Danny Mendick. If you follow baseball, Danny Mendick was getting some substantial playing time with the White Sox in 2021 and just had a gruesome collision in the outfield going back from, I believe he was playing third base or shortstop at the time. Anyway, left side of the infield. And just a brutal injury, a knee injury, ended up with a torn ACL and more. And so I wanted to discuss, ACL injuries. Obviously this gets talked about a lot, but it doesn't get talked about as so much as in regard to baseball and recovery because the commentators were talking about the um, severity of ACLs and the difficulty coming back and the psychological issues that go along with that. And I think we think about that a lot in football, but I don't in basketball, obviously, in soccer. But I think that baseball is one that we don't in softball, we don't really think about it as much. And what it takes to come back from this. So I just wanted to talk about the injury and the recovery, and obviously just some education on the and some data on the surgery and the recovery process, and then get everybody's thoughts. I mean, that's why I wanted to stream live today. Yeah, it's 2 o'clock in the afternoon on the East Coast here, so we may or may not get a lot of viewership, but that's okay. We'll do what we can, and hopefully we can kind of get some questions in here. But yeah, I think that's something we don't talk maybe a lot about is that the psychological aspects that come along with with recovery from ACL. And I think we think about it some, but I think we also forget a lot of times that it is a long, grueling process because the surgery has come so far and because you're almost guaranteed to recover now, it seems like. And I think we kind of can get complacent as sports medicine professionals in thinking that, oh, well, it's an ACL. Before, I mean, 20, 10, 15 years ago, it was, oh my gosh, it's an ACL. Is it ever going to be the same? And now it's like we almost assume that everything's going to be great. And I think that kind of stepping back and understanding what goes into the injury and what goes into the recovery and kind of some of the things and looking just getting back to the basics is maybe beneficial for us as clinicians and understanding that um ACLs are not just run of the mill. It's a major procedure. It's obviously a major surgery, similar to how a UCL would be in a pitcher. Tommy John surgery would be in a pitcher. I think we're the same way with that, and we'll talk more about Tommy John surgery in the next couple weeks as that becomes more of an epidemic, obviously. But just kind of thinking about ACLs, I think we have to be careful not to become complacent and to understand that it takes um it takes a lot. It takes a lot for the athlete. It takes a lot for us as the clinicians. It's a long process. I mean, 6 to 9 months is a long time. Um, and so yeah, I just want to touch on that a little bit. So please give your questions and comments in the Facebook Live or on the Instagram Live if you're tuned into one of those. Obviously, if you are listening anywhere you get your podcast via Apple Podcasts or really anywhere else for that matter, you can DM us either if you're a member of the athletic training room as an athletic trainer, you can obviously put your comments in there. This will be posted in there. You can comment on YouTube. You can email athleteadvise@gmail.com to any questions, comments, concerns you might have, and we'll address those via video and or via response, either email, DM, etc. So lots of different ways you can contact us. There's also a poll on Facebook if you are on the Facebook Live dashboard, or if you're watching via Facebook. Um, and it's have you ever rehabbed an ACL first and foremost? Um, and I think that's it'll be interesting to see because I almost assume at this point that um most people have. Um, and unless you're a really young clinician, but it seems to be more commonplace than ever. And so I just think it'd be really interested to see how many of our viewers and how many of our audience are have gone through that or have as a clinician. And also comment on their on the chats, um, how long it took your athlete to come back from that, because I think that would be really interesting to see as well, just to kind of get an average of how long that took or what have you. So, um, as far as the injury itself, you know, like I said, it's a really prevalent injury, and we talk a lot about prevention and what it takes to prevent ACL injuries and what does that mean? And there's obviously the I'm blanking on the name. I think it's the FIFA 11 maybe. And please, somebody, soccer people, yell at me if I'm way off base with that. But the it's a lot of hamstring work, obviously, and the Nordic hams and things like that. It maybe have some promise in preventing ACL injuries in soccer players. But the bottom line is it's mostly non-contact, which is why we stress prevention so much. There's not a lot of rule changes like there are in a lot of sports that can prevent ACLs. Um, in baseball, we've tried to lessen pitch counts to limit injuries to the UCL. We've tried to do a lot of different with football. We've tried to decrease head-to-head contacts to decrease concussions, soccer similarly. And so um, I think that, you know, ACLs are different in the sense that there's not a lot of rule changes that we can do or put in place that will prevent the injury. I think all we can do is the preventative stuff as far as hamstrings, quad balance, really working on our muscle balance and strengthening the structures around to try to take some stress off of that. But the bottom line is most of these are non-contact injuries, and most of them are non-contact injuries. Excuse me, most of them are non-contact injuries that landing involve landing or pivoting. Um, and just to kind of get to some of the data and as far as the prevalence go, oops. Uh, Sorry, everybody. Got got kicked out of Instagram there for a second. Just to kind of go through some of the data as far as prevalence goes, we've seen the highest incidence of this in really soccer, basketball, football, and probably snow skiing. Anything where the knee's going to get caught or the foot's going to get caught, and there's going to be a pivoting motion. Obviously, we see it some in baseball. We saw it with Danny Mendick last year or 2 years ago. I'm sorry. And uh, but we see approximately in the United States, there's approximately 200,000 ACL tears per year in the United States, which seems to be an astronomical number. But if you think about, and don't get me wrong, it is an astronomical number. That's an incredibly high number. And I would suspect, and I don't have the data in front of me, but I would suspect that number is probably down from what it was 10 years ago, or and the interesting thing is how much we can actually bring athletes back from this now. But I digress. Um, it's a primarily an injury that occurs in female athletes. Um, we see a much higher rate in tears to female athletes. Um, and in some instances, the data shows us 2 to 8 times higher risk in female athletes, just depending on what sport they're playing. Personally, I've had um, quite a few ACL tears working women's soccer. Women's basketball is probably my next highest, and then football. So I mean, my two of my top three are female sports, and that's a lot of different reasons. If you are an experienced clinician, or if you're kind of go through this, we know about the female athlete triad, right? We know about the Q angle. We know about the different physiological and biomechanical difference in females versus males. So there's inherently more of a risk for females, and that's not being sexist. That's just the what the data tells us, the epidemiological data tells us. And so it's incredibly important as a clinician for a female sports, for women's sports, to focus on that preventative aspect if in your plan, especially if it's something like basketball or rugby or soccer, cheerleading, things like that where we're going to have high impacts and rotational and twisting. Most of these injuries are occurring in individuals between 15 and 45 years of age. Why? Probably because those are the people playing sports. It's probably less in the top end of that range. It's probably mostly 15 to 30, I would say, because let's be honest, by the time we're 30 to 45, we're probably not participating in sports so much. Maybe we should be, maybe some of us are, but those higher velocities of torque are probably going to occur at that younger age, unless we're a professional athlete. Um, like I said, mostly non-contact injuries. Data shows us that 70 to 80% of all ACL injuries are non-contact, usually through deceleration. And this brings in the question of, so I tore an ACL. I mean, a lot of times you can play with a meniscus tear and repair it after the season sometimes, right? You put a brace on an MCL, maybe we can work through it. It's non-surgical, whatever. Why does an ACL have to be repaired? Well, one, it doesn't heal itself. And two, um, we can't stop without an ACL, or it's very difficult. I've known a lot of people who have had ACL tears and never have them fixed, and they function just fine as human beings. But when they start running at a high rate of speed, you can't really change direction. You can't decelerate. Um, when you land, your knee shifts because you have that translation tibia over the femur, and so yeah, I mean, it can be detrimental, and obviously it sets you up for issues down the road, like like arthritis and bone on bone and meniscal issues and all that kind of stuff. And that's why we end up seeing a lot of other concomitant issues with ACL tears. So really reconstruction is the best path a lot of times, but obviously talk to your orthopedic surgeon if you're a clinician or you're an athlete who's watching this that has is been unfortunate enough to suffer an ACL injury recently. And you may, let's segue that right into our graft types. And if you're talking about reconstructing an ACL injury, what are kind of the choices? And there's a lot of different options, or a few different options now. Allografts, which are going to be from a cadaver. So you may take an ACL from a cadaver, or really any tissue. So, ACL or a patellar tendon or a hamstring tendon from a cadaver. Usually those patellar tendons and hamstring tendons are going to be coming from as autographs from the patient's own body. And so, just depending on the surgeon and the preference, a lot of times, it will depend on what they use, but autographs are typically more common than allografts. But again, it depends on the surgeon, it depends on the philosophy, and it depends on the patient as well. Do you want two surgical sites? Have you had a previous injury? What is your sport? What is your level going to be when you're coming back? So there's a lot of different things. The other thing, as far as reconstruction trends recently, are trending towards some use of, obviously sometimes we're using biologics along with that, some PRP and things like that could be used. Now, that's not all the time, and I'm not advocating for or against that, but understand that could be a possibility as well. Does that speed up healing? I think the jury's still out a little bit of that, but research suggests that, we may have some promising results. But we'll have to dive into that deeper at another time. The big thing is to understand about the different types of graphs is we're going to have different rates of recovery with different graphs, and we're going to have different um, pain levels, different rehabs, just because one surgical site versus two. Are we doing a hamstring graft? So we have to do more hamstring work on the other side or on the same side, or is patellar tendon. So maybe we have more scar tissue built up and all this kind of stuff. So there's a lot of different things that go into it. So understanding the graft type and what was done, be it BRP or not, is obviously really important as a clinician to understand the rehab protocol. And that's discussion with your physician, with your orthopedic surgeon. That's discussion goes into understanding um, healing principles, and understanding the forces that go along with that. Understanding graft type, because maybe we need to have that ligamentization come into play, where if we take a tendon, that tendon has to now have a different function. And so it may take some more time, and we need to avoid certain stresses. And so maybe that slows down our rehab, maybe it doesn't. So again, talking to your orthopedic surgeon about that, working closely hand in hand with your physical therapist, to be able to make those rehab decisions for the betterment of the patient, and ultimately not rushing back. I mean, the goal is to get back to competition at or at a better rate than you were at previously. And if you do that in 6 months and you're doing it safely, great. If you do that in a year and you're doing it safely, great. I mean, I think everybody's different, everybody heals different, and so I think it's unfair to compare one person to another. We have to compare ourselves to ourselves when it comes to how we heal. There's a lot of different things that come along with that. Um, Understand too that results wise, different graft types are going to have different results. Typically, autografts are chosen more regularly because they show better results. There is a lower rupture rates than with autografts than allografts. Um, so just understanding all of that kind of stuff. Um, as far as outcomes go, I think, like I said, it's different for everybody. And so I hesitate to give these numbers just because I think that sometimes we get caught so much in the numbers and we don't think so much about the patient. And we need to be patient focused. We need to be symptom focused. We need to be practice based. We need to be evidence based. But numbers are evidence, right? And so we've seen return to pre-injury level of activity in 80 to 9% of 90% of 80 to 90% of patients. And when we start talking about numbers like 80, 90%, I think instantly that gives us complacency that, oh, well, no problem. Um, so, you know, what's the issue? And I think the issue is doing it correctly. I think the issue is doing it, making sure that our patients are doing it safely, because we've also seen about half of the patients that have ACL tears within 10 to 20 years have some sort of arthritis issues. Now, 50% is an 80 to 90. Um, but is there anything we can do as clinicians to prevent that? And I think I'm not saying that there is or there isn't, but what I am saying is that I think that it's something we need to be aware of as clinicians, that we need to take every step necessary to not only treat our athletes for the short term, but treat our athletes for the long term. And I think that's going to be probably a theme you'll hear on this podcast and these episodes over and over and over again, is treating the whole patient for the entirety of their life and not just the period of time where they're playing sports. So, um, I think obviously there is a very high rate of return as far as ACLs go, and that's incredibly promising. It's a big deal. It is a big deal to have that high of a rate of return. And um, when push comes to shove in the short term, that's what we're trying to do as clinicians. However, um, we have to also keep in the back of our mind that this athlete has a life beyond that. And if most of the athletes we're treating, if we're at high school or the college level, which most of us are, and even the professional level, are between the ages of 13 to 40, right? Um, and probably more like between the ages of 13 and 22. We're talking 80 years after they're done playing sports that we have to account for. Um, and be able to, you know, have our athletes be healthy in the long term. There's only so much we can do to prevent, and there's only so much we can do as far as the actual reconstruction of the ligament, because obviously that is outside our pay grade as athletic trainers. But what we can do as athletic trainers is look out for our athletes in the long term and make sure that they are practicing best practices after recovery, that they are recovering properly, that they are eating properly, that they are going through proper nutritional channels. And probably most importantly, and we haven't touched on this, and it probably doesn't get touched on enough, is that psychologically, from a mental health standpoint, they're where they need to be. It's such an overlooked piece of any rehab program, but especially something like an ACL, that yes, there's a really high rate of return, but 6 to 9 months is a long time. A year is a long time. And we'll talk about this too when we talk about UCLs and we talk about really any injury that's going to put an athlete out for the season. This is probably their identity in most cases. And so we have to understand that this has been their job and what their goals are and their dreams. And when this happens to people, understand that this is devastating. And we have to be there to pick up the pieces ultimately, whether we want to or not. It kind of comes with the territory. And so we need to remain calm as clinicians, as athletic trainers, We need to reassure our patients that, hey, it's going to be cool. I'm here for you. We're going to get through this together, and just kind of be that person that's that support system, um, and look out for signs of, depression and anxiety and things that come along with that, especially not just in sport, but sometimes that's their comfort zone, and the rehab is their comfort zone, and it's other aspects of it that you may catch wind of, school, etc. So, just being aware of the sorts of things is really, really important, because then you can bring those to the proper areas and proper channels, and refer to the proper people if necessary. The people that are trained to deal with those sorts of mental health issues. But something we shouldn't take lightly, certainly, and something that we need to certainly keep an eye on. Um, over the long term, and till our athletes are back. But I tell you what, when we as clinicians finally get our athletes back on the field, there's nothing like seeing our athletes who have been out for a long time take the field again and come back. And that's certainly something that we have done a fantastic job on as a profession over the years, particularly with regard to ACL injuries. And our return rates are incredible. The sports science aspect, and a lot of us have the resources that to be able to work with sports scientists and see the biomechanists and et cetera. Take advantage of all the resources that you have at your disposal, because those things are only going to improve our athletes' chances of coming back long term, coming back um, quickly, coming back healthy, coming back, obviously for good. So, um, yeah. So, like I said, everybody who's on, I obviously really appreciate um, everybody. Oops, activate. I appreciate everybody watching. Apparently, I forgot to activate the poll. If you are watching, please feel free to vote. Um, I don't think. Yeah, nobody has voted. Yeah, that's okay. If you have any questions and you haven't had a chance, if you're watching this on delay or you're listening on the podcast, please feel free to reach out um, at Athlete Advise on Instagram. You can also find us on Facebook at Athlete Advise if you're part of the Athletic Training Room group, and you're watching after this post on Thursday. You can obviously ask questions in the comments section there. If you're not part of the Athletic Training Room group and you're an athletic trainer, please join. It's a great community. We have some great engagement, some great thoughts, jobs, and things to post in there, and some great products being advertised on there that can be really beneficial for your athletes. But it is like I said, a community exclusively for athletic trainers. So please check that out. Message me if you need a link to that. Make sure when you are joining that you answer all the questions so we can vet your account, vet your profile. It's something that we take very seriously. We try to make it a very exclusive group for athletic trainers and athletic training students. So we all have a community together where we can see all the newest news and notes, help each other out with issues we're having, maybe with rehabs, or share stories, and just be support for each other, because we're stronger together as a community. Again, thank you everybody for watching. Thank you to our sponsors, Firefly Recovery and Essity. Again, those links will be in the description um, down below there. If you're on the podcast, or you are watching on YouTube, you're well. Also, please subscribe to our YouTube channel if you haven't already, to see the video versions of these. If you're listening to this via podcast, if you're watching the video online, subscribe to the podcast. We love to have you, and you get all the notifications when everything comes out. So, thanks everybody. We really appreciate all the support. And we will talk to everybody soon. Have a fantastic rest of your week, a great weekend, and keep them healthy.